Okay, not yet, but hopefully down the road. Well, Lawrence, why don't you come up and sit up here with us? Now, Lawrence, you had this surgery. Can you explain a little bit about what you did specifically for him?
Yes. So for Lawrence, his keratoconus was what we call asymmetric, meaning the cone is more inferior and temporal. If you look at the cornea in the center, it's more to the side. So that's why he cannot wear contact, or a little wobble kind of thing. So in his case, we put the rings in such a way that I could literally move his cone more towards the center, make him more central, if you may. So he's now much more dome-shaped curvature. He literally is seeing with his glasses. So coming out of hard contact lenses and inability to see, this goes back to my analogy of an 11 feet tall person looking for a suit. Now he can go and just get glasses and he's fine. We will talk about this later in our webinar of how even that we are taking care of now in the next stage where we can do laser on an Intact. But so Larry becomes different from James as many other patients as you can design how you're entering, what thicknesses you've used of each segment, and how you even place it strategically to arrange the architecture.
To, again, change how
that cone will become a dome.
Okay, perfect. For you, did you go to a number of different doctors and were told that there really you had no hope, or explain your experience?
Well, with me, it was over the course of 2 years. I was in contact lenses first, and I noticed it kept on shifting and changing my eye vision. And then every 6 months, I would have to get a new prescription. So I finally asked the doctor, I was like, where can we go next? And he says, well, let's do some more detailed research on your eye. And as he was looking, he says, I think you have keratoconus. And I was like, kerato what? And that's when I started going on the web, and I started searching the World Wide Web for keratoconus and all the different options. And I come to find out the best person for keratoconus was here in Jacksonville with us, Dr. Gulani. And I went to go see him, and he explained to me what the problem was and how my eye was uniquely different than most keratoconus patients because of a cone-shaped difference.
Did you notice a difference when you were wearing your contacts that they didn't fit correctly?
It was more of an inconvenience because I couldn't keep it in my eye. It was actually shifting on my eye, off my eye.
So you'd have to constantly put it back on or
so it
move
doesn't
it
stay
around.
on a dome,
It's
so it's
not
kind
gonna
of
stay
on
there.
a seesaw.
Yeah. And being in the medical profession and doing presentations at work and everything's like, excuse me, I can go to the bathroom and fix my eye, contact lens.
You can't do that.
No, and it was an inconvenience. And I was looking at the option going back to glasses. But through Dr. Gulani, I was able, to go to glasses. And my power was reduced from a -550 to a -3 now.
Wow.
And my vision is so clear now, it's like night and day, the difference.
How long ago did you have the surgery?
I had it last August.
You had it last August. Were you nervous about doing this procedure?
After doing the research on the web and seeing the different options available, I asked Dr. Gulani, what about the vitamin shots and the different options I had? He said, Larry, for what you have, the only thing that would work is the Intacs implants. And I had to space them specifically because of your cone. And after reviewing the surgeries online, and I said, well, this doesn't take too long. He said, oh, in 7 minutes you'll be out. I said, elected to have the surgery. A couple days later, notice I can see my alarm clock again. But over the course of 6 months, it kept on getting sharper and sharper and sharper. And even to the doctor's point, I mean, every time I came in, he was so excited. It's like, Larry, you're seeing clearer and clearer. You're almost 20/20. And with my new glasses now, I am 20/20.
What is your prescription, or what is you're 20/20 with your glasses.
Correct.
How about without your glasses?
20/30.
20/30. So that's very,
Pretty
very
much there,
good.
yes.
You're better than me. And I have contacts.
And I was almost legally blind. He was saying, Larry, you're almost blind in your right eye right now. If we let this go any farther, it could get worse. So it's a disease that doesn't get better on its own, and it has to be managed in such a way that it is right for you.
And last question for you. Recovery, you know, do you feel those Intacs? I mean, again, I'm just surprised that you can't feel anything because it just looks like you would feel it.
That was the beauty about it, is like, okay, you're actually there having the surgery, and in 7 minutes it's all over and you feel nothing.
It wasn't even painful during the surgery? Not
even during the surgery. And it's one of those things, it's like you're looking up at him and he's doing this and you feel so comfortable, and it's like, oh, it's over? It was that quick. And then for 2 days, you don't feel nothing, and next thing you know, you're seeing clearer. But over time, that's where it really gets because it gets something sharper and sharper, and it's like the next day is like, okay, what's gonna be this day gonna be like the next day? And doing presentations, I do a lot of presentations at work. I can actually see the screens now without having to struggle and squint, and that was really a big beneficiary.
Thank you so much for being here today. I
Thank
appreciate
you.
it. And we've